You're listening to Aging Uncensored. Welcome back to Alphabet Soup, Part 3.
All right, I think we've covered all of those different levels from home health, private care, companion care, sitters, whatnots. Let's dive into who covers all these things. So we talked a lot about the private care, home care, and that's out of pocket, could be the VA, could be long-term care insurance. But there's a lot of different questions around Medicare, Medicaid, all those things. So I'll kind of jump in and talk about the Medicare side, right?
And can I just say, I wish they had different names.
Yes.
People hear Medi,
yes.
And they don't care what's on the end of it. They think they're getting something for free.
That's right. Exactly. That's not the case. So let's just go on Medicare as it relates to someone age 65 and older, because there are times when somebody has been determined to be disabled through the government that they may qualify for Medicare. But that is above my pay grade, and that is where we will have an expert on to go through those things. But when you turn 65, you are eligible for Medicare. Straight Medicare. You're going to get that red, white, and blue card. It used to have your Social Security number on it because that was your...
How you got your Medicare.
That's how you got your Medicare. And then people were like, wait, people are going to steal my identity. So now we have, numbers and letters that are your Medicare number. And at age 65, you have an opportunity to keep just your Medicare, which is Part A, which is like hospitals and things like that, covering the hospital care. But then you can choose to, and it also covers a couple of other different things too, with Part B and so forth, but you can choose to maintain just your traditional Medicare, and that's it. Or you can say, I want my traditional Medicare, but I want a supplemental plan, which is like what you'll see Part C or C plus or things like that, where you have your traditional Medicare and then you pay extra out of pocket for this supplemental plan, and it covers all the things that Medicare stops covering, like co-pays and deductibles and things like that. But it's got a higher premium
basis.
You pay a monthly basis. And so when somebody looks like they're going to be utilizing the healthcare system more, that is when it's a good option for them.
And you can get on that how often?
At least once a year during open enrollment.
Okay.
Again, we need to have some of our Medicare experts on here to dive into all those
Sometimes
things.
the professionals go to a professional for help.
That's right. We do seek professional help for more ways than one. Then you have what we call Medicare Advantage. Medicare Advantage is where you chose to either your employer offers this retirement package because they have negotiated with a national insurance company like United or Humana, and they are going to offer you as part of your retirement this Medicare Advantage plan. But people still think they have traditional Medicare. No, you have a Medicare Advantage plan. And each Advantage plan, whether it's Viva, which is our local one in the state of Alabama, a Blue Cross Blue Shield, which is is state specific as well. So it could be Blue Advantage, it could be Viva, it could be United, Humana, Cigna,
Aetna.
All of them. There's a bunch of them. The problem is when you have those plans, you have to make sure that your physicians accept it, because each of those insurance plans have negotiated certain things or just have said, I'm not going to pay for certain things. And so it's really hard when we're navigating with a family and they felt like they've got this top insurance plan because it was through their employer, but they didn't know that it's not going to pay for all these levels of short-term rehab or inpatient rehab, or it's not going to pay for certain providers, certain physicians, and so forth. And so that people get confused about what that looks like. When you're healthy and you don't utilize it that often, Medicare Advantage can be great. Certain ones can be great because you're not utilizing it. But if you look like you're going to utilize it more, there may be something state specific, like our Viva plans, our Blue Cross Advantage plans that have more opportunity and cover more things. Because I will say the Advantage plans now, we're seeing some of them pay for transportation. Some of them pay even like send gift cards for groceries.
Or send prepared meals.
Send prepared meals. So there's a lot of great things that you have. I mean, they send you these huge booklets, and if you really want to go to sleep, read one of those. But diving into them and seeing what's specific is very important, and the drug plans and things like that. So there's Medicare, and then there's Medicare Advantage, and you fall under one of those umbrellas. And then once you fall into one of those umbrellas, it also depends on, do you have a supplement? Do you have a prescription drug plan? Or what level advantage and what does it pay for in your specific area? That is why we would say seek someone who represents these different insurance policies and looks at it from on behalf of that client. What are their conditions? What are their medications? And have a review every year during open enrollment, which is October through December.
And how do those people get paid?
They get paid based on the insurance policy that the person picks up.
So I'm not paying thousands of dollars for someone to tell me which plan to get?
No. And you want somebody that has enough of a relationship with most of the providers that can really guide you the right way. And, we have several relationships here in town.
What if I need everything? What if I can't afford to pay for anything?
I can't afford to pay for anything. So depending on your level of income and your level of assets, you may qualify for what is Medicaid. Maybe you're not able to work. Maybe you're on some form of Social Security disability. Maybe your only income is Social Security, and your Social Security is like $900 a month. That's all you're getting. Through the different community-based organizations, typically what we call AAAs, Area Agencies on Aging, they're going to have representatives there that can help guide you through the Medicaid process. And there are so many more acronyms when you get into where area agencies can help you. There's, again, food services. There are prescription, free drugs, prescription plans, things like that. And that really you need to seek somebody that works in the Medicaid system on a daily basis. And they're state specific. So where Medicare is a national, everybody across the states have to follow certain rules for Medicare. Medicaid is state specific, and it's also specific on what that state has to provide through Medicaid.
Right.
In the state of Alabama, Medicaid really only pays for very limited home and community-based care, caregivers coming into the home, and for long-term nursing home. In some states, it covers assisted living. Unfortunately, in our state, it doesn't. So that is very state specific, and that is where having somebody that works in these area agencies on aging are very important to seek.
But if I have Medicaid for my medical care, how do I get skilled nursing?
So if I have Medicaid for my medical care, and I need skilled nursing, what I need to do is seek a skilled nursing that is Medicaid accepting, which the majority of the nursing homes in the state of Alabama are Medicaid accepting. Then you would go through, or your family would go through, a whole Medicaid application. And they're going to be looking at your income. They're going to be looking at past checking amount saving, checkbook savings, all those things.
The 5-year look back.
Thank you. Sorry, I can't even say checkbook right now, but they're going to look at your past finances in the past 5 years, what you've spent your money on. Have you given your money away to people? What does that look like? If you truly do meet that criteria, though, the process for going through a Medicaid application is not that difficult. Where it gets a little hairy is when maybe somebody gave me bad advice and I decided to give my money away to one of my children, and then my children didn't use that money for my care, and squandered it, and now it's going to put a penalty on me.
So in other words, if I have $1 million and I'm 85 and suddenly I need skilled nursing care and I've given...
You're not going to qualify for Medicaid.
Damn it. What if I've given all my money to my children and my nieces and nephews, and then I need skilled nursing care?
When did you give it to them?
Last year.
You're not going to qualify. Now, there are all kinds of loopholes and things like that, and that's where you would want to go meet with a elder law attorney, somebody who is trained on Medicaid, understands the process. There are also representatives out there that will help families with, Alabama Family Trust and different things that you can do, but you're not going to fool the system. That's the key. You're not going to fool the system. If you've got $1 million and you need a nursing home tomorrow, you're going to be paying out of pocket.
Mm-hmm. Very good.
Yeah. And I'm sure some of the elder lawyers and our friends out there are like, you didn't say this, you didn't say that. And that's because we're going to send them to you.
That's right.
All right.
But I do want to say that planning ahead is key.
Oh,
so
absolutely.
If you have absolutely no money whatsoever, you're going to be looking for family members that are going to be able to support you and to know where to go, what to do, who can I live with, what facility do I feel most comfortable with. Go ahead and be thinking about that. If you are someone who has a little bit of money, but not enough money that's going to last you forever,
right,
then you need to be looking at what's called a Medicaid spend down and being accountable for your money and how you're using it and the way your kids or you are spending it so that you do qualify for Medicaid. Because you can be in situations where you're in a skilled facility and you're having to pay privately even though you don't have it.
Right.
So think about that, and then think about, if you have lots of money, what your home life versus skilled, and go ahead and make a plan for all of that.
Absolutely. It's so important. I think that if you come into retirement, if you come into caring for yourself or a loved one without a plan, it is very difficult. It causes lots of family issues, all the things.
So if you're a parent out there and your adult child comes to you and says, let's make a plan, you do it. Listen to me.
That's right.
Do it.
That's right.
Don't say, I trust that you'll take care of me when we get there, because I guarantee that type of parent doesn't have their child as a power of attorney,
right,
doesn't have their adult child knowing where all their accounts are, having access to those accounts in any way, shape, or form, tells them where the security box key is. None of that. Don't be that parent.
No, and so many times we'll sit down with families and the adult children go, my parents were ashamed. They didn't tell me they've racked up all these credit card bills and they've got this huge, balance on their second mortgage or all of these different things. And now all of a sudden, where they thought mom and dad had money saved for their care, it's not there.
Right.
And then they're looking at their children that are working their tails off going, well, you're going to take care of me, right?
Maybe not.
Maybe not.
Or you have an adult child with a parent who says, oh, well, I'm not going to give you power of attorney because you're going to steal all my money.
Right.
That's ridiculous. I mean, you have those jerks out there, but for the most part, if you have 2 or 3 adult children, make them all joint powers of attorney and that all of them have equal say.
Right.
So that you don't have one kid coming in and calling all the shots, but you have multiples. If you just have one, ask a niece or a nephew or a friend,
right,
someone else who has more insight and that can help if you're afraid that your child is going to take all your money.
Absolutely. And we'll definitely have some of our attorney friends on the podcast to talk about the ins and outs and, why it's good to maybe have, if you've got multiple kids and one, the son lives out of state, but is really good with finances, maybe you make him durable power of attorney, but your daughter that's in town, understands all your healthcare and knows your doctors, she can be healthcare power of attorney and what that looks like. Mm-hmm. So we've kind of gotten into this POA. We've moved to that conversation.
So Christy, what's a DNR? What's a POA, DPOA? What's a pulse? What's a living will?
Wow, lots of acronyms. Here we go. Okay, let's start from the very beginning. you need to sit down and have your estate documents. And because all the things that Nicole just threw out there are all documents that your lawyer and your physician, but mainly your lawyer, can help you with these documents. And let's say you don't have a ton of assets or things like that. There are resources. There are senior resources for lawyers that are out there helping seniors put these simple documents together. But everyone needs just the basics. Your power of attorney, and that power of attorney can be called a durable power of attorney. And that looks like everything that needs to cover your finances, assets, real estate, all of those different things. Can I change beneficiaries and so forth? You want somebody that you trust, and then you want to share with them what you're giving them and when to use this, right? And there's all kinds of legal things in there, but you want a durable power of attorney. It could be called a general durable power of attorney. And then sometimes within that power of attorney, there will be healthcare power of attorney verbiage, like who can make decisions on if I have a surgery or not, who can make decisions on where I need to move to, like assisted living or skilled nursing, who can make decisions on caregivers that can come into the home. So that can be separate documents or it can be one document. Then you have what we call advanced care planning. And that's what used to be called a living will. What happens if I become terminally ill or injured? I am incapacitated.
But my doctor's always asking if I have an advance directive.
So that's what is now called an advance directive. So it'll be an advance directive / living will, right? And what that is I am terminally ill or injured deemed by 2 physicians. And the only way for me to sustain life is by hooking me up to a machine and or feeding tubes, right? Because I cannot get nutrition and hydration in a normal way. It has to be provided through like a feeding tube, IVs, so forth. And I'm not getting any better. I'm not going to get better. How do I want to live? Do I want my family to watch me in a bed just living on a machine? Or do I want to give them the choice at that opportunity to make the decision that my mom doesn't want to be on these machines and on these feeding tubes? It's okay not to pursue that, and you're to follow my directions that way.
And if you have your advance directive and a power of attorney, you're so much more powerful than if you have nothing.
And yes. And then you need to check those on a regular basis. If you put these together 20 years ago and your dead husband or your husband that has now dementia is your proxy on your advance directive and your agent on your healthcare power of attorney, you need to make those changes because there's a whole nother conversation about capacity of when you can make these changes and so forth. Then we have something called a DNR or a DNAR, do not resuscitate, do not attempt to resuscitate. And a lot of times when we're talking about admitting someone on hospice and their end of life and they're in their home, people will say, well, my mom has a DNR. No, she has an advance directive. Something totally different. A DNR or a do not attempt to resuscitate actually has to be signed by a physician. So you as the person can say, yes, I want this, and then the physician sign it. The person that has power of attorney can talk to the physicians and they can sign it. And there are a number of different ways you can do this. But that means I'm in my home, I go unresponsive, and they call EMS. Or they call my hospice provider. But let's say they call EMS. If I have a do not resuscitate, EMS comes in and they do not have to go into executing CPR on me, which could really leave me in a bad state, right? But if I have a do not resuscitate, they know to give me comfort and things like that, but they're not going to try to revive me.
What's the opposite of that?
Going through CPR and becoming a vegetable? Yeah.
Like a full code, basically.
Yes. Okay. Thank you. So that's what you'll see in communities where you're talking about assisted living, nursing homes, so forth. They'll ask, what is your code status? Full code means do all extreme measures, CPR, everything. Bring it on. Or they'll have that DNR and they'll have that form, right? And you need to make sure as the advocate for your family that if they are do not resuscitate, that everybody, even the agency nurse that's there that day, knows that you are a DNR.
And you have to give copies of that to your physicians, to your hospital. Every time at
I would even say wear a bracelet.
Yeah. At our local hospital, you have to announce every time you're admitted that you're DNR.
Yes. Yeah. Don't assume they know, because they don't. And then we have what's kind of in the last few years become new is the
At least
POLST.
in our state. It's been in other
especially in our
states.
state. Yeah. But as the POLST, POLST, Physician Orders for Life-Sustaining Treatment. So that's kind of a combination of a DNR and advanced directives, right? Talk me through that.
So that form is something that you talk about with your doctor. So generally you take it with you to an appointment and you say, if I'm in the hospital or if I am found at home and I'm breathing, I'm not dead yet, but there's something else, that could cause me to die. Do I want to be left to die, or do I want to be taken to the hospital? Once I'm at the hospital, do I want certain levels of care? Do I only want antibiotics if they're not going to fix, but they may alleviate some of the symptoms, like fever or something like that? Do I want medicines that are more palliative in that respect, or do I want the doctor to decide what's going to happen? More treatment. So it's different levels of treatment. No treatment, some treatment, all treatment.
Comfort.
Yes. And in that situation. So that is new. And even a lot of our physicians don't necessarily know what that is. So when we had some clients go to their different doctors, we actually had to educate the doctors on the form and then sit there and advocate for what our client wanted their pulse to look like. And then the doctor signed, and then we gave it to other physicians in the local hospital and the adult children, and it stays in their emergency notebook.
Absolutely. Oh, emergency notebook. That'll be a whole nother podcast on
Toolkits.
How to plan our toolkits. We have gone through a lot of things, and I bet we're kind of close to wrapping things up. We'll go into we didn't even get into like the dementia screens and things like that. I really do think that's a whole nother podcast. All that to be said, we have stacks more of acronyms and terms and things like that. That is why it's so important to seek professional help in navigating long-term care. We didn't
have a plan.
Yeah, and have a plan.
Just simply have a plan.
Talk to your family. Sit down and talk to your family. Give your family the gift of knowledge. Where are the documents? Where are things? How can you pay for this? What does this look like? And how can you have these conversations? People will say, well, I have a will. You know what? When we're executing your will, you're not needing any of this help because you're gone.
Right. And at what age should someone start doing this?
Now.
Exactly.
Now.
So if I'm 35 and I just had my first kid,
you need those documents. Yes, absolutely. What if you're traveling with your husband and you have an infant at home and something happens? Like something crazy, like I contracted some illness from, a bug in the Caribbean or whatever else. I mean, there's so many different ways. When Alan and I travel, we call his brother and sister-in-law, who are our agents, and go, okay, here's where everything is. Here's the code to the safe where you can find so many documents. Here's our attorney. Here's our accountant, all of those things. And you've got to update these documents as your life changes. We now have an adult child. So what does that look like for her versus our son that's still a minor and independent? And then as you grow, what does that look like? I hope both of my children continue to be responsible people, but if there's a point in time when one of them's not responsible and has made bad decisions, I don't want that person to be an agent on my documents. And maybe I don't want to leave that family member just tons of money. Maybe I need to set them up in some type of trust. So there's all different things that you've got to continue to have. Just like you go to a doctor for checkups, you need to have checkups on all these documents.
So if I'm 85 and I have adult children and I executed all of my legal documents when I was 35,
you haven't planned appropriately. You need to update them again.
Try again.
That's right. Well, I'm going to wrap up this episode. And again, if you like what we are talking about, give us a thumbs up, like us, subscribe to us. We're on Spotify, Apple Podcasts, some other different things. Taylor will put YouTube. Taylor will put all those descriptions so we know that we get it right. Tune in for our next episode. We'll probably just continue on all of these acronyms and things like that, alphabet soup to be continued. Because as you can see, we are unfiltered, uncensored, and definitely unscripted. So thank you, Nicole.
Thank you, Christy.
My partner in crime and co-host. And thank you all for tuning in and listening and watching whatever we're doing at this point in time. And have a great week.
Bye.